Hello and welcome to the University of Tennessee Medical Center's Wellness Wednesdays web series. COVID-19 has impacted every aspect of our healthcare system throughout the country, and certainly for us here at UT Medical Center. And while the past year has been challenging and transformative, many lessons have been learned. We're here to share that wisdom with you. In this new video series, leading clinicians from the Medical Center will share updates and information that will be helpful to you as you re-engage with your physician, schedule important screenings and checkups, and navigate staying healthy and getting the care you need in 2022. So welcome to Wellness Wednesdays. Let's dive in. First of all, I would say that after the Omicron surge, we're continuing to see cases and hospitalizations drop. And so at this precise moment, I feel as good about where we are in the pandemic as I have for a significant period of time. Now, we do know that there can be new variants and new information that can come out of nowhere very quickly. And so I don't know what next week brings, but at least for the information that we have available to us right now, feeling really favorable. Now, as far as the challenges that we see, I think one of the things from a healthcare standpoint that's really affected us is that the Omicron surge came really right after the Delta surge, just within a few months. And so what we really want to see for the entire healthcare system, both in the hospital and outside the hospital, is with each passing month that we don't deal with another big COVID surge. It gives the providers and the healthcare systems an opportunity to reset, and it also gives the public time to really start to refocus on those things about their health that they may not have been focused on for these last 2 years. So it's important for patients to re-engage with their physician now for several reasons, but I can think of three right off the bat. First of all, obtaining preventative services. And so we know, and there's data that proves that things like colonoscopy when it's appropriate, mammograms, other preventative services really have dropped off during the pandemic, and those can have some longer-term health implications. Secondly, patients who have chronic illnesses, like diabetes, for example, may not have been seeing their physician as routinely and as regularly as they would have otherwise. And so it's important to re-engage with a physician to make sure that the maintenance therapy and the control of those chronic conditions is where it needs to be to prevent more problems down the line. And then third, we all know the effect that the pandemic has had on mental health. And so if someone is in a situation where either they're dealing with a new mental health issue or maybe a pre-existing issue that has been exacerbated by what we've been through, I think that's another very important reason for people to re-engage their provider. If the person has a primary care physician and has not seen that person in a while, hasn't had what we call an annual visit, a full physical, then I think it's time to try to reconnect. And so to try to get an appointment with the primary care physician, because that appointment then becomes the launching pad and the reset for everything that may or may not have happened over the past 2 years. And depending on the patient's needs, as we've already talked about, some might be scheduling preventative services. For others, it might be really tuning up some chronic illnesses. So to wrap up, I would just say that now is the time for folks to think about their health and wellness. Contact your physician if you haven't had an appointment in a while. And then also we encourage everybody to watch our Wellness Wednesday series, because we're going to try to guide people through as many of the different issues as we can over the next several episodes.